Hi, this is Vidya. I'm a doctor of physical therapy, and I'm making this video to share with you some self-treatment options we have in managing and treating lower back pain. I'm a trained PT in McKenzie's approach of treatment, and as a clinician for over 19 years now, I have seen a great success in treating lower back pains with this approach, so I wanted to share it with you. Before we understand more about the causes of lower back pain and its presentation, it is important for us to understand the spine. This is the model of the spine. There are 7 vertebrae in the neck, 12 in the middle back, and 5 in the lower back, followed by a triangular bone called sacrum, which again is connected to 2 flat bones on either side, forming the pelvis. Each vertebra has a solid body in the front and a hole in the back. When these vertebrae are stacked upon each other, this hole aligns, forming a canal through which the spinal cord or the bundle of nerves extend from the neck down to the lower back. Now when we look at the front of the spine, we can see these discs separating each vertebrae. And each disc consists of a semi-fluid center called as nucleus, and the nucleus is then surrounded and held together by a cartilage ring called as annulus. There are 2 joints on either side of the vertebrae that connects to the one above and below, creating a small opening on either side through which the nerves leave the central canal or the spinal canal. The nerves coming from the lowest lumbar vertebrae and the sacrum collect and form a bundle, making the sciatic nerve. There is one sciatic nerve on the right and there is one on the left supplying the legs. Pain caused due to the compression of sciatic nerve is called sciatica. When the spine is aligned well and everything is situated in its own confined space, we don't have a problem. However, if there is any alteration of any of these structures or damage to these structures, then it presents as a discomfort or pain. There are many reasons for the lower back pain or the pain which radiates down the leg. A few of the causes or the reasons are degeneration or arthritis of the spine, which can cause narrowing of the canal, causing pressure on the nerve, or tightness of piriformis muscle, compressing the sciatic nerve in the buttock, or one of the most common problems is the disturbance of the disc position, causing pressure on the nerve at the spine level. The exercises we are going to discuss in this video are to address the pain that is caused due to the disc. There can be several stages and severities of disc problems, but as long as these outer rings are intact and the internal disc material is protruding or herniated within the rings, we may correct it by performing certain movements of our spine. Coming to the causes of lower back pain, always the first place goes to bad posture. The reason why is because if our body is in normal posture and everything is aligned well, we don't create lot of stresses. But when we put the body in a wrong posture for a prolonged period of time or over the period of time, you are developing or you're overstretching some structures and you're compressing some structures. So you develop a bad posture, and that overstretching with the over period of time is going to create a lot of stresses on the spine, especially the lower back, because that is the junction where you have lot of movement happening. That is the junction of between your upper body and lower body, the lower back. So it takes a lot of toll from bad posture. If you think about this, majority of the time we are doing all the activities in front of us. We don't do anything to think of where we put our hands behind our back for a long period of time and do any kind of work. So people who are working at a desk are in sitting, so which is also a form of forward bending. Sitting is also a forward bending position. Reaching for something like cooking, cleaning, or working with the computer, anything we do is majority of the time in front of us, not behind us. So that is the reason why the back of our spine gets stretched more compared to the front of our body. So that is the reason why these exercises, like what we are talking about, is the reverse of what we do to cause a problem. So extension is bending backwards. So when we think about like why we have to do extension and why not flexion, is because majority of the time the problems are caused due to excessive flexion, excessive bending for over period of time, for prolonged period of time. So when you try to reverse that movement, you are going to reposition or readjust structures in the spine, especially when it comes to the disc, because when you bend forward, you are creating a strain in the back of the spine, causing the derangement or the displacement of the disc. So when you reverse it, you are now trying to put the disc back in place. In simple words, that's how I can explain that you are trying to put disc back in its place. Let's now check what is the ideal sitting posture. When we are sitting in a chair, especially for longer durations of time, we have to make sure our ears are in midline with the shoulder, our shoulders are placed above our hips, and hips and knees to be at 90-90 position with feet fully resting on the floor. So it is important to make necessary changes to attain this posture, especially when we are sitting for long durations of time. So when we sit with our spine slouched and rounded position for too long, we lose the normal curvature of the back, causing overstretching of the structures in the back. And it in turn causes back pain. If we don't correct it, it becomes difficult later to reverse it and ends up being a chronic problem. Especially when you are in an episode of lower back pain, it is very helpful if you take a towel, roll it up into a small roll like this, and place it in the arch of your back. You can move the towel up or down depending upon your comfort. Actually, your back will guide you where it is supposed to be placed because it feels good when you have it in the right place. The best thing about using a towel is you can make it thinner or thicker to fit your back right. When you're having an episode of lower back pain, it is very difficult to change positions, especially when you have to sit into the chair or stand up from a chair. It can be very painful. So during these episodes, maintaining a straight back is helpful. So you keep the back straight, and using the arms of the chair, you can slowly lower yourself into the middle of the chair, middle of the seat, and scoot back all the way to bring your hips all the way into the chair. Same thing when you're reversing, when you're coming up to standing, try to use the arms of the chair, keeping your back straight, move the hips forward to the mid part of the chair, and slowly try to come up to standing. When coming to the standing posture, we again want our ears, shoulders, hips, knees, and ankles all aligned in a straight line to be considered as a normal posture. Whenever we bend forward to reach, we are again creating the rounding of the spine, in turn stretching and straining the structures in the back. Practicing good bending and lifting techniques are helpful to relieve these stresses and take care of our back. The idea here is to keep the spine in a neutral position without slouching and using hips and knees to help to go down when picking something heavy requiring both hands, or sometimes even something which is light all the way from the floor. If you have a support nearby, like when you're unloading your laundry from the washing machine, you can use the support of the washing machine with one hand and bring one leg up like this to reach down and pick your clothes. Same thing can be practiced when you reach to the grocery cart. Both these activities require repeated forward bending, so maintaining a straight lower back helps in preventing pain. Before we start or commence any kind of self-treatment, it is very important for us to understand a few things. So we should make sure that these following situations are not there before we start any self-treatment. They are like any recent falls, accidents, any history of cancer or tumor, history of having like lower back pain mostly at nights. So night pain, it's a warning sign. and also like having any kind of bowel and bladder symptoms, or having like weakness in the legs. So sometimes along with the lower back pain, which is radiating down to the both sides of your legs, you might also experience that there is weakness in your legs, which is getting worse with each day. Or sometimes you might not notice it so quickly, but you will notice that, oh, I've been like, not being able to walk properly, like my foot is getting stuck, like, so things like that. So these are all warning signs. So before commencing any kind of self-treatment, it is important for us to get it checked first. Make sure the doctor checks and okays you for the exercise so you can start these exercises. Otherwise, please don't commence exercises in these situations without getting checked with the doctor. The exercises which I'm going to show you later in this video are very effective in some situations. Like, say for example, if you have lower back pain along with the pain radiating down one side of your leg, your buttock, thigh, or like sometimes like all the way down to the knee, if you feel like radiating pain down one side of your leg, and you've been diagnosed with sciatica, these exercises which I'm going to show you are very effective. In other situations, like where you suddenly developed lower back pain when you try to reach and pick something from the floor, or when you were exercising and if you're doing like abdominal curls and you feel like you threw your back. And also like in situations where you bent over to wash your feet, or you were in a long drive for about 3 hours or 2 hours or sometimes less, and you're not able to get out of the car. Like you were fine when you were driving, but when you're trying to get out of the car, you're not able to because of the severe lower back pain, and you have severe difficulty straightening up. So in these situations, the exercises which I'm going to show you are effective, and it is definitely worth trying. Also, in another situation, you feel good like when you're sitting, but when you try to stand up, it's very painful. And then once you stand and start moving, you feel better. So in that situation also, you can try these exercises. So basically what it is like you will be fine, but then suddenly you develop pain because of some wrong movement or some wrong bending. And majority of the situations when you develop this pain is when you bend forward and you try to do something there for a long period of time, or try to lift something from that position. It happens, and it's almost like you feel like something happened in your back now that you're not able to straighten your back. Bending feels better, straightening feels worse. So in those situations, the exercises which I'm going to show you are effective. Also for people who have been having like multiple episodes of back pain over the period of time, sometimes just low back hurts, but sometimes it radiates down your leg. These exercises are very helpful in those situations. The purpose of the exercises that are shown in the video are to manage the pain, to decrease the pain, to control the pain. So this is the first step of the treatment. So these are like first aid exercises. So whenever you have like a sudden episode of lower back pain, or when you have pain for a long time, which is now getting worse. So any of these situations, you have to start, when you start doing these exercises, try to avoid all the other exercises, because that is how we are going to find out how your body is responding to these exercises. When we are doing exercises, it is very, very important for us to understand the pain pattern. So we know whether we are doing the right exercises or the wrong exercises. So when we talk about pain pattern, there are two specific pain patterns when it comes to the pain caused due to the irritation of a nerve. Say for example, in sciatica, even though the pain starts in your lower back, you will have the pain radiating down your leg. So when you do the exercise, as the irritation of the nerve is reduced, the pain which is away from the back, which is in the leg, should get better first. And we call this as centralization of pain. So that means we are bringing the pain close to the source of pain or the origin of pain, which is your spine. Not just that, if you have like back pain, but it doesn't go down to your legs, but it is on both sides of your back. So when you start doing exercise, you feel like the pain is getting more to the center of the back, and that is good sign. Whereas, say for example, if you're doing your exercises, all you had when you started was like pain across your lower back and some pain in the buttock, But as you started doing exercise, you started to feel more pain going down your leg, down to your leg. That is not a good sign, because we are irritating it more somehow, that it is getting irritated more and the pain is traveling more away from the back. So that is not a good sign. So these two concepts we need to understand. So when we are doing self treatments, it's very helpful for us to find out whether we are doing the right thing or the wrong thing. So let's say here the blue tape represents my pain pattern. So I have pain in the lower back radiating down the buttock and the thigh all the way down to the knee. So once I started doing my exercises, I was able to slowly feel better in the back of the knee and thigh first. And as I kept on doing exercises, now even my buttock pain got better. And though my lower back pain remained, but that's okay. So I just kept doing my exercises to basically centralize that pain more to the center of the spine. And as I kept doing exercises, I was able to completely get rid of the pain. This is a correct pattern you want to see. The incorrect response is you first have pain in your lower back, and as you kept doing your exercises, now the pain appeared in the lower thigh. That is not good. As you kept doing exercises, your lower back pain felt better, but you still had more pain in the thigh. That is also a not good sign. So this pattern you don't want to have when you do your exercises. So when you have a sudden onset of lower back pain and you're having great difficulty to move or to straighten up your back, the first and foremost step you have to do is to lie down on your stomach. It is preferred to lie on a floor, a hard floor, but if you cannot reach to the floor, try to lie down on the bed with your feet off the bed. So once you lie down on your stomach, try to stay there for about 10 minutes or so and see how your pain is feeling. When you think that the pain is slightly better, slowly try to come up onto your forearms like this. If you cannot do this movement because of increased pain in your back or too much pressure in your lower back, it's okay for you to go back to the first position and try to stay there for a few more minutes. In this position, you can also use a heating pad, or if the pain is too much, you can use some pain medication to control the pain. So when you think that you're ready to go up, try to go up again and see if you can get that movement. For some people, it's very difficult when the pain is severe to get into this position on day one. It's okay. On day one, just continue to lie down on your stomach whenever you can. Now when you try again to go on your forearms, if you still cannot do, you can also use some pillows and prop up your back like this and use pillows as support. So try to do this until you are slightly feeling better, and whenever you can, try to come up on your forearms actively. If you can, try to repeat this movement for about 10 repetitions. When you're lying on the floor, you can use a small towel roll at the lower part of your legs for comfort. So ultimately, our goal is to extend our back all the way up by extending our elbows. So gradually, you're going to work up, get into that position. So once you are up all the way, you feel pressure in your back, and that is okay. The pain in the back might be more, but that is okay because now we are able to get all the way up. So every time you get into this position, try to tell yourself that I'm putting pressure on my back, and when I'm returning back to the floor, I'm relieving the pressure on the back. So it's like pressure on, pressure off, pressure on, pressure off. So you try to repeat this for about 10 times and rest for a little while and see if you can go for another set in this position. If your arms feel tired, it's okay for you to come off the position and try to get back into the position maybe an hour later. While we are doing these exercises, try not to do any kind of forward bending movements. Try to keep your spine in a neutral position as much as you can. When you sit, you have to use the towel roll. So we are not reversing what we have done so far. Try to repeat these extensions 10 repetitions every hour for up to 7 times a day. While you're doing these exercises, keep on assessing on how your pain is behaving. And if it is moving in the wrong direction, please stop the exercises. Now, say for example, you have been doing these exercises for a while and the pain is less, but you feel like, okay, the pain is getting better, but it is not remaining better. You can now progress this exercise by adding a little bit of force in the same position, like this. So when you do your prone press-ups and come all the way up, you try to repeat it 2 times normally. And the third repetition, once you're in the position all the way up, try to breathe out. This adds more force on the back while you're in that position. So repeat it. Go for the 4th and 5th normal repetitions, and the 6th repetition would be by breathing out again. So try to do this for another 10 repetitions. So you will be adding about 3 of these exhalations when you're all the way up. So this is a small progression which you can do when you feel like you're getting better, but it is not remaining better for too long. If you're unable to get onto the floor or get onto the bed and lie down on your stomach at all, you can also do your back extensions in standing position. So in standing, keep your feet hip width apart, place your hands slightly above your hip, and start moving backwards, taking your body into extension. Try to repeat 10 repetitions. Keep on telling to yourself this pressure on and pressure off as you're doing, so it can guide you through your movement pattern. When you're performing it in standing, try not to bend your neck excessively back, because here the focus is the lower back. If you are having difficulty to do that, try to look to the side, to the right or to the left, and avoids you from excessively bending it backward. If you're going in the right direction and if you're doing the exercises correctly, you will be able to get rid of the pain within few days. Sometimes same day. It depends upon the severity of the pain you had. When you feel that the exercises are not helping, please check these few things. Whether you're doing the exercises correctly, are you avoiding excessive bending movements? Are you taking care of your back when you're in sitting position? Are you maintaining a good posture? Are you doing enough number of repetitions? And when you do the exercise, are you going all the way back until you feel like a stop or a pressure in the back? So like I mentioned before, these are the first aid exercises. So these are the exercises you're trying to do to fix a problem. The pain might come back, but not immediately. Like, if you stick to the protocol and do the things the right way, you can completely abolish the pain. You can completely get rid of the pain. And later on, you have to be more careful about your posture, the way you do your exercises. Everything matters. So you prevent another episode like this. And sometimes day-to-day activities we do are something which we have no control of, and you might get into a situation like this again, but you can repeat the same thing and try to fix your problem. And also doing strengthening exercises like core strengthening to keep your spine strong will also help you to decrease the recurrence of these episodes. So we can also discuss about the exercises which you can do to strengthen your spine in a future video. So now if we summarize what we have learned and what we have done so far, we learned about what are the main causes of low back pain, and we discussed on 2 things here. One is posture, and number 2 is due to overstretching or overbending, or it could be any cause, like the disc has been moved from its place. So depending upon that, you will develop symptoms. Sometimes the pain could be just in the lower back, sometimes it's only on the left side, or sometimes it's only on the right side. So when this situation occurs, the first and foremost thing you would do is try to straighten your back. if you cannot straighten your back, the easiest thing you can do is go and lie down on your stomach. You see and you assess like what is happening in your back while you're lying down on your stomach for a while. You'll feel like, if we are doing the right thing, you'll feel a great relief in that position. And also you feel like you are able to straighten the back better in that position. Initially, the pressure will be more, but as you stay in that position for a while, you feel like you're getting better. And when the pain is very, very severe, sometimes patients cannot tolerate this position. So it is better to talk to the doctor and get some kind of medication to take care of the initial severity of the pain so you can tolerate these things. And so say, for example, you tolerated the lying down on stomach position well, then you try to slowly start to come up in that position. Like I showed you, it could be prone on, like lying down on the stomach and coming up on your forearms or elbows or all the way up. So the ultimate goal is to come up all the way. Okay, once you're able to do that, try to do 10 repetitions, assess your pain, see how your pain is behaving, and if everything is going well, try to repeat another 10 in that position. Or if you think your arms are tired, you can come off that position. Like you can do the same exercise in standing in the situations where you're like, okay, I cannot get on the floor because I'm not able to get up from the floor. So at least try to do this exercise like I showed in standing position. Try to do 10 repetitions. Take a break. Meanwhile, try to avoid any of forward bending movements. Try not to sit too long. And if you sit, make sure you're sitting with a towel roll like we just showed before. So once you do this, after an hour, try to get into one of these positions like lying down or in standing and try to do another 10 repetitions. Like that, spread out throughout the day, trying to do at least 10 repetitions every hour for about 6 to 7 times a day. And then see how your pain is behaving. By now you will have an answer, like whether you're doing the right thing or whether you're doing something wrong. Stick to this protocol for about until your pain is completely better. So once you feel better and stay better for about 48 hours, then you can slowly start introducing other exercises. But again, like, when you try to do the other exercises and you feel like the pain is back, stop. So this is something which, if you understand, it is very easy for you to take care of your back. So whenever a problem occurs, okay, this is what I can do. And then when you do, if you feel better, that's very good. But if you don't feel better, then we have to go and consult a doctor. Hope this is helpful. So if you want to know more about it, try to get this book, which is Treat Your Own Back by Robin McKenzie. Robin McKenzie is the founder of McKenzie's method of mechanical diagnosis and treatment approach. So this book is like highly recommended to have. So you can understand your back better. You can learn more about what you can do and what you cannot do to manage your back pain. This is it.